Without health insurance, getting sick or injured could mean going bankrupt, going without needed care, or even dying needlessly. We know there is real interest from the American public in having easy access to the new, affordable choices in the health insurance marketplace. For many Americans, including many who are employed, going to the doctor when they fall ill or become injured may not be an option because of the absence of health insurance. We're trying to take a leadership role in solving the nation's healthcare crisis. We want everybody in this country to have health insurance. Many kids come out of college, they have a credit card and a diploma. They don't know how to buy a house or a car or health insurance or life insurance. They do not know basic microeconomics. A tremendous amount of needless pain and suffering can be eliminated by ensuring that health insurance is universally available. Soaring prescription drug costs have placed a tremendous strain on family budgets. They have also imposed a heavy burden on employers, both public and private, who are struggling to provide affordable health insurance coverage to their workers. Our system of private health insurance that fails to provide coverage to so many of our citizens also contributes to the double-digit healthcare inflation that is making America less competitive in the global economy. Women oftentimes are the ones making those economic decisions, sitting around the kitchen table and trying to figure out how to pay for rising gas prices or food prices or the health insurance costs. And I think that they see where they expect their leaders in Congress to also make those tough decisions. If you're healthy, if you don't get sick much, if you don't go to the doctor much or use your health insurance much, you are a genetic lottery winner. It has nothing to do with the way you live, nothing to do with doing the right things. It's just sheer luck, and you are going to pay for that. We should all have the legal right to purchase health insurance from any insurance company in any state, and we should be able to use that insurance wherever we live. Health insurance should be portable. The result was, of course, that today, tragically, more than 40 million Americans don't have health insurance, and for many, not having health insurance means they don't have access to good health care. Nobody likes insurance companies, especially health insurance companies. If it's really so wonderful that both partners have to work to make a living to pay for their house, for health insurance, someone is obviously going to get the short end of the stick. Quality child care, health insurance coverage, and training make it possible for former welfare recipients to get, and keep, jobs. In Indiana, the Affordable Care Act will raise the average cost of health insurance in the individual market by an unaffordable 72%. That is why I think any kind of a stimulus package is going to have to help people who are without work, without a job, help them have health insurance. Well, there are about 10 million children that aren't covered by health insurance. About 3 million qualify for Medicaid but don't get it, so we're going to reach out and bring more of those kids into the Medicaid program. The majority of Americans receive health insurance coverage through their employers, but with rising healthcare costs, many small businesses can no longer afford to provide coverage for their employees. At my pregnant wife's behest, I took the job for the paycheck and the health insurance, and it turned into Sharknado. I couldn't have played this better if I'd wanted to. It's really captured the imagination of sci-fi fans. Reducing healthcare costs for families requires increased competition in health insurance. And in terms of their crown jewel legislative achievement, who knew that when asked, will government impose a new federal mandate requiring middle-class Americans to buy health insurance whether they can afford it or not? The answer would be, yes we can. I think first and foremost everybody should understand that Canadians are strongly committed to the system of universal health insurance, to the principle that your ability to pay does not determine your access to critical medical service. Before Medicare, nearly half of American seniors were forced to go without coverage because insurance companies were reluctant to insure them, making the chances of having health insurance as a senior the same as getting tails on a coin flip. People don't trust private health insurance companies for all the right reasons. 1 in 7 Americans lives without health insurance, and that's a truly staggering figure. Mention health in most companies, and the cost of health insurance is what comes to mind, not how the company can invest to prevent further escalation in societal healthcare costs. Today we have a health insurance industry where the first and foremost goal is to maximize profits for shareholders and CEOs. Not to cover patients who have fallen ill or to compensate doctors and hospitals for their services. It is an industry that is increasingly concentrated and where Americans are paying more to receive less. Everyone should have health insurance. I say everyone should have health care. I'm not selling insurance. The Supreme Court has never ruled that Congress can use the Commerce Clause to require individuals to engage in an activity they have chosen to avoid. Yet that is precisely what Obamacare does. It forces Americans without health insurance to purchase coverage. Such a requirement is unprecedented and unconstitutional. As a physician and a U.S. Senator, I have warned since the very beginning about many troubling aspects of Mr. Obama's unprecedented health insurance mandate. Not only does he believe he can order you to buy insurance, the president also incorrectly equates health insurance coverage with medical care. One of the major goals of health insurance reform is to bring down the cost. Most illegals are without health insurance, and when these workers need emergency health care, the American taxpayer gets stuck with the bill. People have criticized me for seeming to step out of my professional role to become undignifiedly political. I'd say it was belated realization that day care, good schools, health insurance, and nuclear disarmament are even more important aspects of pediatrics than measles vaccine or vitamin D. Today right here in America we have 50 million people without health insurance. We have taken on the health insurance industry, we have taken on the drug companies, instituting programs to lower the cost of prescription drugs. I have nightmares that I'm going to wake up, and everyone's driving a Prius and living in a condo, and we're all getting health insurance. Successful health reform must not just make health insurance affordable, affordable health insurance has to make health care affordable. Because when we think about the real facts, 44 million Americans without health insurance, millions without jobs, a 50-year high on mortgage foreclosures, an historic high the third year in a row on personal bankruptcies. Opportunity expands when there is excellence and choice in education, when taxes are lowered, when every citizen has affordable, portable health insurance and when constitutional freedoms are preserved. There's definitely evidence that capitalism at its most ruthless rewards psychopathic behavior. When you look at the worst corners of the American health insurance industry or the subprime banking market, it really feels like the more psychopathically someone behaves, the more it's rewarded. Pharmaceutical companies are enjoying unprecedented profits and access with this administration. Yet the Republicans' prescription drug plan for seniors has been a colossal failure, and over 43 million Americans wake up every morning without health insurance. Health insurance should be a given for every citizen. Each state has its own health insurance mandates, and some of them are good, but there are about 1,800 of them all across the nation, including provisions for acupuncturists, massage therapists, and hair replacements. Anywhere you have extreme poverty and no national health insurance, no promise of health care regardless of social standing, that's where you see the sharp limitations of market-based health care. I'm sure that the standard of public morality we've helped build will force government in Canada to approve complete health insurance. We should allow people to purchase health insurance across state lines. That will create a true 50-state national marketplace which will drive down the cost of low-cost, catastrophic health insurance. I think the United States and the Secretary of State should be concerned about the poverty in this country, people without health insurance. The United States should stop being the empire and be concerned about other countries. You've got to be more worried about your own people. While some people are certainly seeing economic benefits, many others are unemployed, underemployed, without health insurance and struggling to make ends meet. People are ready to say, yes, we are ready for single-payer health insurance. We are the only industrialized country in the world that does not have national health insurance. We are the richest in wealth and the poorest in health of all the industrial nations. Visit our website for more quotes, quoting.com.